I'm Dr. John Kruse, and today I'm going to be talking about gaslighting and ADHD. I just can't really believe that anyone would think that people with ADHD could possibly gaslight anyone. They're not even capable of doing much. And why would anyone want to be gaslighting them? It's just so ridiculous and so absurd. And, you know, who's going to believe them anyway? They have ADHD, and you should be listening to me on this. I'm an expert. I've been doing psychiatry for 30 years, and I'm a neuroscientist as well. That's my example. I hope you know that that was tongue-in-cheek of gaslighting. So I will restart the way I normally do. I'm Dr. John Kruse. I'm going to be talking about ADHD and gaslighting today. Take-home message is that gaslighting is an increasingly commonly used term. Originally, it was intended to mean, or it meant, that someone's pre-planned, intentional, prolonged, manipulative behavior induced another person to feel like that they were going crazy or couldn't trust their own reality. And it has clearly broadened and expanded in a wider sense. The claim that's frequently put out there is that individuals with ADHD are more vulnerable to being victims of gaslighters because of shame, criticism, already questioning themselves because of their neuroatypical brain. I do think that there is validity to that. But many of those accounts ignore that people with ADHD also are more vulnerable to gaslighting because of their neurotypical differences, their forgetfulness, their inattentiveness. They have more trouble staying on track. And I believe people with ADHD are also more vulnerable to perceiving themselves the victim of gaslighting when it's not really going on because they are missing information, missing out on the context, or have poor time management or other problems. There are some people who think that people with ADHD are also more likely to be perpetrators of gaslighting because narcissism is a contributor to gaslighting and is more prevalent in numerous studies among the ADHD community than the population at large. And the other aspect is many people with ADHD are more prone to making untrue statements. We can get into that in a moment. And that is a characteristic of gaslighting, is consciously deceiving people there. Again, we have almost no hard data on anything relating to ADHD and gaslighting. It's lots of theories. So I don't have a lot of data to present at all today. It's more theoretical. I think the evidence that people with ADHD are perpetrators or more likely to be gaslighters is very weak, and I haven't seen much evidence for it. On the other hand, I think they are far more likely than the general population to be accused of being gaslighters because people misinterpret their neuroatypical behaviors as intentional perpetrating, manipulating of others. In many ways, gaslighting is like ADHD, that if it's there, it's really important that you identify it and deal with the situation. And if it's not really there, if it's really something else, then it's really important not to falsely diagnose it if it's not there. So jumping into gaslighting, what is it? It's interesting that most of the articles, most of the commentary on gaslighting, and maybe they don't want to go into the history too much, is that the term comes to us from a 1944 movie by George Cukor, who is a prominent director of the post-war era. The film was called Gaslight. Ingrid Bergman starred in it, and she was a wealthy socialite with a manipulative husband who wanted to steal jewelry from her and went through elaborate ruses to restrict the information and access to others and to create perceptions that she was misinterpreting reality, including doing things to dim the gaslighting in the house and then denying that he was seeing or others around her were seeing anything, so that it was all her perception. So that movie was actually and some people cite this in the references, a remake of a play by Patrick Hamilton, who was a prominent British playwright. He also wrote Rope, which Alfred Hitchcock made into a movie. But interestingly, so in many of the histories of gaslighting, Patrick Hamilton gets sort of gaslit or written out of it. The movie was the start of it all. So the play came out in 1938. The British movie in Britain, it was called Gaslight. In the US, it was called Angel Street. It wasn't a big hit, apparently, but when MGM Studio started making the George Cukor directed film with Ingrid Bergman and other stars, MGM tried to buy up all the copies and were fairly successful of the British movie, so nobody could remember it, go back to it, compare it, or look at it. So in some ways, that is an act of gaslighting to eliminate the truth that there was actually a movie about gaslighting before Gaslight. And certainly starting from the movie, gaslighting referred to a romantic relationship where one partner, and predominantly it was the male, was manipulating the environment, causing doubt in the woman's mind that she was losing her sanity or couldn't trust her own senses or appearances. It's also frequently used these days to refer to workplace situations. And again, it's almost always a person of power who's doing the manipulating. So the boss or coworkers are gaslighting an individual to make them not trust themselves. And some of the Freudian analysts have commented or inserted that you should probably be paying as much attention to the parent-child gaslighting situation. And although that seems a loaded term to be using, there's oftentimes parents are telling their kids, oh, you fell down. Oh, it doesn't hurt that much. That's a devaluing of the kid's own experience to make yourself feel better. It might also be intended and it might succeed in making the kid feel better, but it is a manipulation that is going to make them less trusting of their own experiences or less believing of the people who keep telling them that. And particularly with kids with ADHD, it's that often a parent displaces their own anxiety onto a child. It's, you're making us late by not being able to tie your shoes or not even being able to find your shoes, or you're the one embarrassing us because you didn't bring your homework in when the assignments were due, or you're wearing the wrong suit when we go out in public. And the Freudian analysts think it's important to be identifying this parent-child aspect or origins of gaslighting because, and it's almost, to use another overused term, grooming, that in some ways this is training kids to be more susceptible to gaslighting when they grow up because they've had this dynamic going on. So often aspects of gaslighting rely on familiar patterns or cultural beliefs. So it's often the hysterical woman who isn't going to be believed anyway, or it's the person with ADHD. Well, they have a mental health problem anyway. They have problems with memory. They have problems with attention. Who's going to believe them, or why should they believe themselves? So it's often enforcing cultural hierarchies. And again, the essence of, if it's really gaslighting, it's not just the person is made to feel that they're wrong. So it's not just guilt tripping, but this is that they are unable to judge their own wrongness. You are doing this or putting them in a position over long enough time that they're not even sure who's right, what's wrong. Psychologists have pointed out that this is turning humility, the humility of knowing you might be wrong, I might not be perfect, into a liability. I mean, I think it's a good thing for people to acknowledge that lots of things we don't have absolute certainty about. But this is turning that asset into a liability because it's relying on the ability of people to question themselves. So unfortunately, gaslighting has sort of devolved into a much broader use, that many people use it for any time anyone is lying or deceiving another person. So lots of political statements are pushed as, oh, they're trying to gaslight us. Now, sometimes they are trying to gaslight us, and sometimes they are just simply lying to us. Sometimes they are not even caring whether we believe it or whether we can trust reality. They're just telling us a lie. Some people use it even more broadly from the victim's perspective, that anytime someone feels that the other person is manipulating them, that means gaslighting is going on, or almost anytime there's a conflict. That gets really tricky and loaded situation because, yes, we should be paying attention to people who report feeling victimized because sometimes they are real victims of horrible abuse. And Sometimes, though, they are not. Sometimes they are creating a serious scenario about a disagreement or conflict that they didn't have other ways of dealing with or interpreting themselves. So a few more insights from psychologists about gaslighting before I go more specifically into gaslighting with ADHD. Often what's going on psychologically is projecting what we are feeling onto others. And in gaslighting, the perpetrator is disavowing their own craziness and projecting it onto the victim. So they don't have to acknowledge that they are anything less than perfect. It can be, see, these weak women or people with ADHD are the ones who are distorted and weak or misinterpreting what's going on in life. Another insight from psychology is that this preys on our deepest fears to be seen, appreciated, and loved. And we all want to be seen as individuals, and we want to all be appreciated for who we are. There's many scenarios described where in the early stages of a romantic relationship, someone's asking information and recipient or the person being asked feels, oh, they want to get to know me. They're exploring intimate issues, and that at a later time, those are pulled up and the person throws it back at them. If you act this way now I understand why your sister swore at you when you were a little kid or pushed you down the steps or something like that. And often that is reframed as that anytime someone is asking intimate questions, that means they are planning in the later point to use them against you. I mean, that I'd say is a fairly paranoid interpretation. It could be. I mean, that does happen. Some people are exploiting their marks and are looking at their vulnerabilities and are sussing them out. And sometimes they are genuinely curious at the beginning, and only later they see a pattern or connection and compare patterns in the past, behavior in the past, to patterns now. So it can be hard to sort out what is actually gaslighting and what isn't. We'll get into that at the end. Gaslighting, again, has become a hugely popular term. It was Merriam-Webster's dictionary's word of the year in 2022. After shooting to popularity, it's in television shows, it's in series, it's in pop music, and not a whole lot of research, a lot of discussions about it, a lot of sort of psychoanalytic, psychodynamics, exploratory, suggestive research. But some of the little amount of research that's come up is that there does seem to be, among the perpetrators of gaslighting, some correlation with what is called the dark tetrad. So 4 symptoms. One is sadism. So enjoyment from hurting others. It's not surprising that sadists are more likely to, or people high on a sadist scale, are more likely to be a gaslighter. Manipulativeness or Machiavellianist, so the willingness to use people for your ends and your benefits and alter their behavior or influence their behavior. Narcissism, which is a defects in your own self-esteem which make you devalue the humanity of others. That clearly seems to be, not surprisingly, correlated with being a gaslighter. And psychopathy, and particularly what are called the first or primary psychopathy traits of callousness, detachment, dominance, and manipulativeness. So some of these 4 tetrad members overlap a lot, but it's people who are cold, cool, manipulating, detached, and what some people would say is sort of pure evil. There are what are called secondary psychopathy, symptoms of impulsiveness, high emotionality, sensation seeking. Those actually are not particularly strongly correlated with gaslighting. And interestingly, people with ADHD are much more likely to align, if they align with any psychopathy traits, with these secondary traits rather than the first traits. And again, the first ones are the ones connected with the perpetrators of gaslighting. And another interesting take is that some analysts and therapists and psychology theorists are looking at what does the victim getting out of this, particularly if they're a pattern of multiple gaslighting relationships they've been in. And one characteristic that shows up in gaslighting is it's what's called splitting. So people can disavow all their badness and put all the badness on the person who is bad and manipulating them. And that's one way of dealing with the fact that all of us are imperfect people. All of us have good and bad within us. And for many of us, depending on our background and our culture and our own expectations of ourselves, it's often hard to acknowledge that we are flawed or bad or have bad desires. And bad is a loaded term. Other people pointed out that there can be something freeing in not being in control. It's sort of like, oh, the devil made me do it. I didn't have a role. I was being manipulated. So that can be attractive at some level. And the third one, getting back to what we said at the beginning and the importance of gaslighting in the child-parent dyad, is that it's a familiar role, and oftentimes, whatever our roles were as children, we tend to replicate them in our relationships with others as a way of working them out. So tying that back in more to ADHD, and again, there's very little hard data on this. But why would people with ADHD be victims? So I'll jump to one of my patients whose comment was, I'm always the doormat. So he felt that in any situation that got contentious, other people would wind up taking advantage of him, and he would wind up acceding, surrendering to them. Interestingly, most of what gets written about is that it's a constant criticism, it's a constant rejection that children with ADHD feel when they're young, that they're being treated differently, they're being shamed, they're being instilled with self-doubt, so a psychological role, and that makes them more vulnerable to criticism or more susceptible to someone who's trying to gaslight them, whereas someone who hadn't been criticized that much will just say, you're the one that's crazy, I'm not crazy. And that people with ADHD are therefore less likely to trust their own intuition. Other things that they don't point out as often, one is people with ADHD are more likely to overshare personal information. They're more likely to give hooks to people because there's a tendency to overtalk and share too much too early. So that creates an added layer of vulnerability. And there's also aspects of them, people with ADHD and their neuroatypical patterns of thinking and acting, that they're going to miss social cues. They're going to miss workplace rules. They're going to be distracted. If you have two people are arguing, and one can stay on track and the other person gets off track, the person who gets off track is going to lose the argument or surrender or be more easily manipulated than a manipulator. And again, many people in their families or school environments had the pattern of being told that they were wrong, that they were insane, that they were crazy, that they were missing information, and maybe an attempt to replicate it or others, but it's just a familiar pattern for them. So I think there is validity. I mean, I certainly see it a lot in my practice of people with ADHD are more likely to be real victims of real gaslighters. On the other hand, I also think people with ADHD are more likely to feel they're being gaslit in situations where there's just really a difference of opinion or even a difference of fact. And they're likely to feel that they're being manipulated. Now, again, part of it is they've probably had experiences where others were manipulating them. But part of it is how their executive functions work, how their attention systems and time management. And people with ADHD are more measurably likely to miss information, to mishear what was said, to not hear something at all that was said directly to them, and it really was. Misrecall what they did or what others had done, to mix the context of what else other people in the room or what had happened before that, because again, sequential processing of a string of information is harder for people with ADHD. So I think that's an important thing to be aware of. Just because someone genuinely does have ADHD and they report they're being gaslit, it's, again, listen to them closely, but it's worth exploring. Could there be other interpretations of what happened? Contention that I find most unlikely is that, again, people with ADHD are individuals. ADHD is just one aspect or set of aspects of an individual. There are certainly some people with ADHD who are gaslighters, or some who are victims, or some who imagine being victims of gaslighting when they're not. There's some who are accused of being gaslighters when they are not. But I would be surprised if it turns out that ADHD individuals are overrepresented among people who are perpetrators of gaslighting. And again, the claim is that because we know that people with ADHD are more likely to fulfill criteria for a narcissistic personality disorder. It's on the range of 10 to 15% in some studies. And narcissism is a contributor to gaslighting. Therefore, ADHD is a contributor to gaslighting. Again, I think the narcissistic criteria, that narcissism and ADHD themselves get confused often. And one of the most insightful, clever descriptions, I think, of ADD brains is that they tend to be interest-driven, not importance-driven. But that means if you think something's really important, they should have been paying attention to, they probably weren't or weren't. That feels like a narcissistic rejection to you. So to look at a more loaded example, if you're president of the country and not doing much to deal with an epidemic that's killing 1 million of your citizens eventually, was that lack of attention more coming from ADD symptoms, that it just, even though it should have been important, it just wasn't that interesting, it didn't register, it's not worthy of energy? So that would be an ADD interpretation. Or was it because of the more narcissistic view, which is the person really thought about it, attended it, and said, who cares? Those are mostly poor people, children of immigrants, other things that I don't care about, that I have no empathy for, and therefore I'm not that worried about the deaths. So there is a huge overlap between what might look like narcissism and what can look like ADHD, and I have a whole other talk on it, so I won't go further. The other thing, getting back to the psychopathy, again, the first primary psychopathy symptoms do not correlate particularly well with ADHD, whereas the secondary ones do. So people with ADHD tend to be overly emotional, overly involved, impulsive. That is not a good setup for being an effective manipulator of other people. You can manipulate them in some situations, but those are not assets or traits for a prolonged, surreptitious blurring of reality imposed on another person. So why might people with ADHD be accused of being gaslighters, though? There, I think people with ADHD are going to be overrepresented in those who are falsely accused of being perpetrators. One is just impulsive actions, doing things without thinking or being aware of the consequences, not being aware of personal space or social space, so stepping on toes, knocking people over, blurting things out, things that might be rude or too candid, but people might interpret that as not only you're being mean, you're trying to subvert and challenge my sense of myself, and they're just really giving a candid impression. And then I do have one of the older talks is on different types of lies or untruths. I think there's an important difference between what I call reflexive lies and reflective lies. So reflective lies are ones where you reflect or think or plan or are premeditated, which are an intrinsic part of the definition of gaslighting, but many people with ADHD, not all by any means, but I think are more prone to give reflexive lies. So often that's an example is I have a patient who forgot his wife's birthday, and he knew as he was driving home that he should have been home 2 hours earlier. He was actually watching videos in the lab where he was working, but he knew his wife would be really hurt that he had just forgotten it, even though she was aware of ADHD. So he just said as he came in the door, there was this terrible traffic jam. I was delayed 2 hours and my cell phone was dead, so I couldn't call you. It wasn't premeditated. And whether or not he really believed she would believe it, or whether they both knew that it was a deflection to not acknowledge he hadn't given enough reminders on his wife's birthday to be there. But I'd say that was a reflexive lie there that could easily have been interpreted as he just didn't care and planned it this way and then lied to cover up and blow me off. So that is, again, one way someone with ADHD might be mistakenly accused of gaslighting, when I would argue that's not genuine gaslighting. I've also seen instances where people with ADHD are really not just not aware of people talking to them, that's a fairly common phenomenon, but not even aware of what they just said. One of my most traumatic therapy sessions was with a mother-daughter dyad, both of them adults, well into adulthood, and had a contentious relationship, partly due to ADHD on both their parts. And I had thought both of them were very nice, kind, sweet, intelligent, proper individuals, and they got into a rather bitter argument. And the mother, in the midst of it, called her daughter a effing asshole and about 4 other cuss words right in a row. And I was not able to intervene quickly enough, but a minute or two later, when things had calmed down and the daughter expressed her disbelief and horror and disappointment and pain that her mother had said these things, the mother just said, "I didn't say that." And she was completely, it didn't look like she was lying. I have some training in detecting lying, but I'm not an expert on it. But, it was a situation I think she could have confessed to it and apologized or other things, but she seemed to genuinely have absolutely no awareness of what she had just said herself. And I think, particularly at highly emotional moments, that may be more likely among people with ADHD than the general population. So other reasons, for the discrepancy between who's gaslighting or not is that someone with ADHD is really likely to have a different perception of what events really happened. Um, and some people with ADHD do have a pattern of insisting that their version is right because they've been canceled so much by people who doubted, questioned them. So what can you do about it? So if it's truly a gaslighting situation, then most advice in most situations, individual variations certainly, is to get out of there. It's probably not that repairable a relationship, even if they try to convince you it is. One thing is to remember that we all want to be seen and heard. So the other person who's disagreeing with you wants to be seen and heard. You want to be seen and heard. So sometimes just acknowledging, okay, I hear you're saying that, and my experience of this can lead to at least the possibility of communication rather than starting out with just a disagreement. The other thing that's important, and so much of what I've read about gaslighting focuses on the shame and sadness someone feels when and why they feel shut down and why they can't fight back. And I would also point out there's a potential problem with anger. So anger comes up when we perceive situations to be not fair. If someone is accusing you of something you didn't do or something that you didn't remember and you remembered it differently, you're likely to get angry. But if you're angry, the other person, if it's not a gaslighting situation, if they are genuinely presenting something they perceived one way, it's different from you, and then you're calling them a liar or you're calling them a gaslighter, that's likely to evoke greater anger on their part. And anger is absolutely a potentially powerful force for good, but it's really good and potent at engendering more anger. And if there's 2 angry people, not a lot usually gets done in that situation. So ways of trying to get out of gaslighting is to try to be open to alternative explanations, to try to observe what someone is doing and describe it without judging it as you knowing what their motives are, to search for other ways to get any objective data or ascertain on it, see if the other person ever apologizes. Maybe a really clever, manipulative gaslighter will apologize or offer a fake apology, but if someone offers an apology, that's an encouraging explanation that they are not as wedded and fixed to their version of reality as they appear to be in the moment of the argument. So I think there are many more disagreements and misunderstanding. This is a philosophy, no proof of that in life, that there's more problems arise from misconception, poor communication, mistakes, error, than there is from absolute evil of people being manipulative or trying to harm others. There are some who want to harm others. Just like ADHD, it's really important, if gaslighting is going on, to identify it, and again, usually to get out of the situation. But if it's not really what's going on, or it can be turned into gaslighting by too much anger on either side, denial and pushback. If it's not really what's going on, it's important to not identify it as such. And I do believe that people with ADHD are more likely to be victims of gaslighting. I think they're more likely to perceive that gaslighting is going on, even when it isn't. So, a doubling of victimhood from gaslighting. And I don't think they're particularly likely to be perpetrators, but I think they are overly likely to be accused of perpetrating it. So that's about all I have to say. And I see a huge amount of questions. So Wesley DeVries asks, does this count for high functioning autism as well? So there is a little bit of research that suggests, and this is an overgeneralization, and many people have both autism and ADHD, and some experts actually think they're the same thing or different manifestations of the same biological thing. But there's some evidence that both people with autism and ADHD are clearly more likely than average to make social mistakes. But if you ask the person with ADHD, are you aware you shouldn't be stepping on someone's toes? Are you aware you should wait your turn in a conversation? Are you aware you should be maintaining eye contact? They say, yeah, I'm sorry, I forgot, I wasn't paying attention. And the person with autism is like, well, that's a stupid rule. Why would you do that? Or no, who cares what you're looking at? You're talking. These are overgeneralizations and sort of extreme, but there does seem to be, again, part of the core definition of autism is a deficit in social processing. Again, it's not shyness, it's not awkwardness that may be there. I think, yes, people with autism are probably more likely to be victims of gaslighting. I guess a really high functioning person with autism may have less empathy. I mean, they may even be more likely to be a perpetrator. So Antonius asks, is memory always impaired in ADHD? So when we're talking about memory, there's lots of ways to divvy up memory. So working memory, keeping things sort of in mind for a few seconds as you go to pick up your pen and write down the date on the calendar or put the item on your shopping list or whatever it is. Many people with ADHD do have difficulties with working memory. Many people with ADHD have, at least by testing, pretty good memory for facts or an event. But often when we're talking about memory, we are also talking about attention. So if something didn't get in, so if I say to Joe, Joe, at 4:00, we're all going to the bar for a drink after work today, and he's busy at his programming and he nods his head, and I think he's listening and paid attention, and everyone goes off. He's in a different room, and the next day said, why didn't you guys invite me to go drinking with you? Say, I told you. And there I'd say it's not a memory problem. It never got encoded in the first place. It never entered because his attention wasn't, he was able to nod. He got the social component there, sort of, but he clearly wasn't paying any attention, so the information wasn't encoded. So there's a lot of difficulty separating out attention from memories. How I'll answer that. So Antonius asks how to differ if this person is a gaslighter. So I've seen different, one is if someone's really, really clever, it's going to be difficult because part of what they're doing is that they're good at manipulating and good at manipulating other people's sense of what's real or not. So a simple one is, if there weren't previously, try to create situations where you have objective data that could disprove them. I would argue at a political, that seems to be simple, but if you look at what's going on at a political level in our country, I think more than a third of our country seems to be gaslit and seems to be completely impervious to any observable data or factual information. So you point out their manners. Other people cite that if someone apologizes, that's something that a gaslighter is unlikely to do. And I think that's a good general rule of thumb. But again, someone who's a clever enough gaslighter to know that they should apologize, they may apologize. Hopefully it doesn't feel or seem as genuine. Or if you push them, or do you understand why you're apologizing? Or do you understand why I'm upset? So Virtual Cam asks, do you have any tips to deal with gaslighting as someone who has ADHD, particularly with parents? So in terms of the tips to deal with it. I mean, I'm thinking, and this is projection because I hear it so often, so this may not be sort of the situation. It's that many parents who were raised in a generation where even kids didn't have ADHD are much less believing in the possibility that adults have ADHD. So I didn't cite Gina Pera, so I will give a shout out to her. Her blog is The ADHD Roller Coaster. Her first book was Is It You, Me, or Adult ADHD? So she's written a lot about ADHD. She was writing about gaslighting and ADHD more than a decade ago, and she writes about it in a much more nuanced and I think holistic way. I think it mirrors a lot of what I said today. So often there's oh, you couldn't have ADHD. Oh, you're just using it as an excuse. I mean, often, so one of her points is that often the people who are most vociferous in shouting down or denying the existence of ADHD, not all, but many of them have ADHD themselves, either at some level were upset that they didn't have that understanding for themselves or that they didn't have it appreciated and they were called lazy, crazy, stupid, whatever they were called. So I'd say presenting information that's objective. I mean, we have lots of good books about ADHD that present objective information to see and say, I think this applies to me. I think you will have a better understanding of me if you read this, and I'm happy to talk with you about it. Often that's less loaded than the direct discussion, is to have them read it at their own leisure, at their own way, or in this day and age, actually watch videos. There's many other channels out there that provide good basic ADHD information. What I almost always am telling in therapy sessions with patients is that you only get to control your end of the conversation, which means not just what you say, but what you think, what you're open to. You may be the most eloquent person, you may be the most adamant person. That doesn't guarantee what gets in the other end. And usually reflecting that you understand the other person is confused, or you understand what their viewpoint is, or you understand, and trying to paraphrase back, but that you're holding this difference is more effective than trying to refute every aspect of what they are saying. Would you speak on the overlap between borderline ADHD and complex post-traumatic stress disorder? There is a lot of overlap. Lots of people ignore, or people with traditional training and who only know the DSM-5 criteria for ADHD, which are only inattentive, hyperactive, and impulsive, not compulsive. There's no mention of emotional volatility, emotional dysregulation, and yet at least 2/3, 3/4, 65, 70% of people with ADHD display that. So many psychiatrists, mental health workers are unaware that ADHD has any emotional component or emotional dysregulation component, and that I think adds to confusion between the two. I mean, I think borderline personality disorder is a valid construct. I think at the core of that is a sense of emptiness and fear of abandonment, troubles regulating the self, and troubles understanding and perceiving the self as an ongoing unit. There are also clearly lots of overlap between chronic post-traumatic stress disorder and ADHD, and I've talked about this. I think Gabor Mate came up last time. He's one of the big pushers that ADHD, I'm caricaturizing, but he says ADHD doesn't really exist, or it's really all trauma that's not been properly processed. We do know, again, I have a whole video on this, people with ADHD are more likely to have physical and emotional trauma in their life. We know that physical and emotional trauma can replicate many symptoms of ADHD, but there are a boatload of people who had, not just in adoptive situations, even in their own biological families, who had supportive, caring, attentive, wonderful, non-traumatic childhoods and still have ADHD. So I do not buy into that all ADHD is just complex PTSD. And I would say it's one of the areas that sometimes medication can be partly helpful in sorting things out. That usually if problems are stemming solely from PTSD, that usually stimulants add to anxiety, add to sympathetic overdrive, and make attention worse, whereas in the setting of ADHD, it can improve things. And Moon Labs shares that they've had ADD for decades, but isn't aware or never thought they've been gaslit. So the question is, are we more prone to being gaslit? Yeah, so I think one of the messages is I think there is, again, there's no empirical data that I'm aware of at all, but I think just from my not just the clinical experience, that's absolutely there, but even just going online on Reddit or others, and there's a range of opinions, but clearly this resonates with many, many people with ADHD that they have been gaslit. And again, many of them, it's starting with their family or telling them, you don't really have ADHD, you're just being lazy. Oh, you could do you could do the math homework, which you're interested in, but you can't do the English homework. It's not any harder. What's wrong with you? You must be late. So one of the first books for the general population was You're Not Lazy, Crazy, or Stupid. And that resonated because that's what many people with ADHD were told, starting with their families. So I think that does, again, prepare people for being further gaslit. But I think that initial parent-child interaction is a gaslighting one. And there was a really good, it's in the references, New Yorker article, April 1st this year. I think the author's last name is Jameson, I'm not remembering. But she interviewed a lot of different people to get a broader perspective. I've drawn on some of her writing here. She interviews, I think his name is Ben Kafka. The author of the article's feeling guilty that she's aware in one of the interactions, she was in a hurry or something. She said something to her kid, and she's aware now, oh my God, that could be considered gaslighting. And she's hoping that Ben Kafka's going to say, oh, no, that wasn't gaslighting. And instead he said, yes, it's all around us all the time. So at a milder level, again, this might be extending. The author wasn't doing it to get the kid to not trust reality, but they were trying to change the kid's experience to fit their own framing of what was going on. So some level, depending on how broadly we frame it, it's really common. So Dylan asks, not ADHD related, but what do I do if alcohol is the only thing alleviating my OCD symptoms? One is, I'm not a big fan of alcohol used for treatment for any condition. Partly because lots of reasons. It's probably brain destructive in the long run and maybe even the short range. If you're using it for anything that's contributing to anxiety, it's probably also, any of our drugs that acutely decrease anxiety, if this is our anxiety level, when they wear off, they don't just leave you at your baseline level of anxiety, they shoot you up. Now, they don't shoot you up as high as they alleviate it. The harm isn't as big, but the duration of withdrawal is usually considerably longer. So depending on how long a stretch you're drinking over, most people, alcohol does help with social anxiety. Most people feel less anxious for 5-6 hours, but then measurably their anxiety is higher for 6 hours out to 18 hours out. The other thing to be aware of is that the serotonin reuptake inhibitors, which are the first choice medications for OCD, often take considerably longer than they do for depression to work. So it's not unheard of for someone to not see much benefit at 8-10 weeks, but by 12, 14, 16 weeks on an SSRI. And people often need a higher dose of an SSRI. When SSRIs alone don't work, often when they're augmented with an atypical antipsychotic, they may help better. There's some people who get good help with an acetylcysteine, an over-the-counter supplement. There's some people exploring whether memantine or glutamate, an MDA receptor blocker, may be helpful for OCD. And there's pretty good evidence that behavioral approaches, particularly behavioral reversal strategies, may help. Yeah, that's, I guess, about all I have to say for today. Thanks for showing up. I appreciate it, and stay healthy and happy.